How's it going, guys? So we've got a 43-year-old woman who undergoes surgery. She has sarcoidosis here. We're making that obvious. The hypercalcemia, erythema nodosum, ongoing dry cough, and she's managed with multiple medications. USMLE wants you to know when they do this for an autoimmune disease, sarcoidosis, IBD, SLE, RA, it doesn't matter. They say managed with multiple medications. This is code for she's on prednisone. They can tell you just straight up the patient's on prednisone, make it easier. Hyper buzzy, pass level, in fact, but they can just say multiple medications. You have to infer. And then she's got a blood pressure that falls to 80/40. We give her a liter of normal saline, so 0.9% NaCl, Ringer lactate, nearly the same thing. They're both types of normal saline for USMLE. Which will find most appropriate next step of management for this patient? Correct answer is hydrocortisone. Okay, so they don't want you to give additional bolus. This is a distractor because the issue at hand here, and I just put out an Instagram reel on this. Some of you are aware of that. Some of you don't follow the IG, that's fine. But what you've got to know is that USMLE, they're going to give you a patient who's on prednisone. And in the setting of a stressor, surgery is a stressor. It can be an infection as well. It can be an episode of thyroiditis. If they're prone to autoimmune diseases go together. So if you have a stressor, this is going to consume your endogenous glucocorticoids. Patients who are on prednisone have a suppressed adrenal gland. You're suppressing your ACTH, and then you get essentially an atrophic adrenal gland. You're not able to mount what's called a stress response, where you make cortisol in the setting of a stressor, and you get an adrenal crisis, as they refer to it. Now, if you don't understand the physiology, let me explain. Do you know the reason that cortisol and glucocorticoids, do you know the reason that they can maintain your basal blood pressure? What's the mechanism? The mechanism is that glucocorticoids upregulate alpha-1 receptors on peripheral arterioles, which allows norepinephrine and epinephrine to do their job by agonizing those alpha-1 receptors to induce peripheral arteriolar constriction to maintain your blood pressure. We call this glucocorticoids are permissive of the effects of catecholamines. Cortisol is permissive of the effects of catecholamines, meaning glucocorticoid permits, it needs to be there so that catecholamines, norepinephrine, epinephrine can do their job. So even if you were to give norepinephrine or epinephrine in the setting in an attempt to increase the blood pressure, norepinephrine would be superior. You're not going to be able to get blood pressure to go up because you have insufficient glucocorticoid. So you have to give hydrocortisone. They can also have IV methylprednisolone as an answer. So you give the glucocorticoid, you get the alpha-1 receptor upregulation on arterioles, and then norepinephrine, epinephrine endogenously without administering it can simply bind to do their job. There's more step one type stuff where you can know that norepinephrine and epinephrine, they both bind alpha-1, alpha-2, beta-1. Only epinephrine is going to bind beta-2 though. Beta-2 is vasodilatory in the periphery, whereas alpha-1 is vasoconstrictive. So because norepinephrine doesn't agonize beta-2 the way epinephrine does, norepinephrine is a better vasoconstrictor. Norepinephrine is the answer in USMLE for septic shock after you give fluids. Epinephrine is the answer in USMLE, obviously, for anaphylaxis, because the beta-2 agonism opens the lungs, okay, and when they have trouble breathing. Dopamine is the answer for cardiogenic shock, stimulates the heart. It's got beta-1 effect in addition to dopamine receptors, okay? So that's your physiology point here. I want you to know that glucocorticoids are permissive of the effects of catecholamines. If you get a question of an autoimmune disease where the patient's managed with multiple medications, i.e. prednisone, and they get a stressor such as surgery, infection, thyroiditis, they get a precipitous drop in blood pressure. After you give saline, they want hydrocortisone or IV methylprednisolone as the answer. You know the deal. I'm going to make more content. Like my stuff, subscribe to the channel. Appreciate your time. That's it.